Good afternoon. This is Rob Asseltine from UConn Health, and I think we're ready to get going. Here we have listed out the team at the Center for Population Health at UConn Health who's leading the effort. We have a veritable army of people working on this, and to date we're making very good progress. At the end we'll talk a little bit about what our timeline is and where we stand right now, but things are coming together very, very nicely at this point. Okay, so this is an overview of what we're going to present to you today. We're going to explain a bit about what the scorecard is and what organizations are being rated under this and why. The measures that we're going to be using to rate each of the organizations involved, and the data that we're using to do this. There are extensive detail today on particularly on attribution, how patients are being attributed to their healthcare organizations. And we will go over that a bit, but I'm going to refer you to a series of documents that are currently available for public comment that can provide much more depth on these issues. We'll review how organizations can participate in the process, and then finally review the timeline for the scorecard. So I think everyone here is very familiar with the State Innovation Model Test Grant, which was awarded back in 2014. We at UConn Health, in partnership with Yale University, are leading the evaluation of the SIM. And in our role as the lead evaluators, we've also taken on the responsibility for developing the state's first quality scorecard. The scorecard is relevant to some of the major SIM goals related to driving healthcare quality improvement through value-based payments. And this initiative is part of what we are doing around quality assessment and measurement. One of the things, we're taking a message from the folks who are on the phone, and they're getting some problems with the sound. We've been notified. So hopefully we can clear that up a bit as we go forward, but feel free to let us know if we're continuing to have problems. So in terms of the organizations we're rating, we're focusing on two categories of healthcare organizations in Connecticut. The first are advanced networks, or networks like you that have
Dr. William Hines
has joined the meeting.
So organizations like you, which are advanced networks and have value-based contracts with insurers, are one category of organizations that are being rated. The other is federally qualified health centers in Connecticut, which are the target, if you will, of a number of the quality and improvement initiatives under the SIM, and would benefit by participating in these types of quality measurements. The goals of this would be to drive quality improvement by being transparent about performance, to provide data for a variety of different stakeholders to assess healthcare performance within the state, and also to provide a resource that's accessible to consumers for healthcare quality information. Now, given the volatility in the industry, we really want to work with all of you and the other organizations that are being rated to define where care is being delivered, what the boundaries of the organizations are, and how we allocate and attach providers to those organizations as we go forward. Here's a list of the healthcare organizations. Here's a list of the healthcare organizations that right now we have worked with the Quality Council of the SIM to develop ratings for. And it's not final yet because we're still working on some of the boundaries for these organizations, how they are related to other networks and organizations, and that is something we anticipate being able to determine and finalize within the next month. Also, we have a list of federally qualified health centers within the state that are going to be subject to the ratings once we have access to Medicaid data, which we don't anticipate having until later this year. So the measures that we're using were developed and approved by the SIM Quality Council, which is a governing body that we are working with under the SIM to develop our strategy and finalize the methodology that's going to be used for the scorecard. So there's a quality measure set that we will show you in a minute what the components of that are, but are also available online using that link. Now, we only have access to administrative components of these measures, meaning claim-based components. There are clinical components to many of them that would have to be derived from EHR data. At this point, there is quite a substantial health information technology initiative under the SIM that is working to make that available. The measures cover a wide range of care domains, and the goal here is for us to maintain a consistent measure set for tracking performance over time. But obviously, we're going to have to work the new data that may be available during the course of the SIM into our measure development as this happens. And here is the overview of the measures that the Quality Council has put forward. This, again, is available to you and will be available to you through all of the documentation we provide in a link that will be sent out after this webinar. We have 3 methodology documents also that we're going to be referring to and will be made available. As I said earlier, these are out for public comment, and they cover the attribution methodology and the logic that's being used, as well as benchmarking, rating, and risk adjustment. We're going to give you a high-level overview of these during the webinar, but the documents will contain much greater detail about the approach. So the data here are all coming from the Connecticut All-Payer Claims Database. The APCD was established back in 2012 as a means of collecting healthcare quality and cost data. Many of you have been key stakeholders in the process of developing the APCD and know that it's taken a long time to get to where we are today, but we're happy to report that we were actually the first recipient of data from the APCD. We are continuing to work with the Office of Healthcare, or the Office of Health Strategies, I should say, that is overseeing the APCD to refine the different data streams that are available through the APCD. And for the most part, this will comprise the data in the initial scorecard. One measure, however, will be derived from
Robert McLean
has joined the meeting.
One measure will be derived from the Consumer Assessment of Healthcare Providers and Systems surveys that are currently being conducted under the SIM with commercial payers and with Medicaid as well. So our initial scorecard that we are anticipating publishing later this fall will use data from fiscal year 2017 that concludes on September 30th, 2017. At this point, we only really have access to complete data through that period. And we anticipate coming back in early 2019 with a second iteration that would be fiscal year 2018 data. The scorecard will report performance separately by payer category, and the initial launch will be commercial data only. We are still working with the Medicare extract that we've received from the Center for Medicare and that came to things. And as I said earlier, Medicaid data is not expected to be given to the APCD until later this calendar year. One point we would like to make here is that there is a gap in the data available through the APCD related to self-funded employers. Most most folks are familiar with the Gobet Supreme Court decision that basically eliminated the ability of states to acquire data from self-funded or ERISA plans. And as a result of that, the only self-funded payer that we will have, or the self-funded plan that we will have in the APCD, is the state of Connecticut, which is the largest in the state. But, that is a limitation and will create some gaps as we work with you to validate the claims that are available. So our attribution strategy is presented in detail in one of our public comment documents, but at a high level, we can summarize it as a two-step process. The first is to attribute the patient to a qualifying provider that the patient has had the most evaluation and management visits during the measurement year. So it's a preponderance of visits approach. It's a very common approach that's used in attribution, and the specific approach we're taking is built off the Trail Solutions 3M logic for attribution. Then in the second step, because we are not rating individual providers, we're rating organizations. So the second step then is to link their providers to healthcare organizations using their NPIs. And again, we have a link here to the details on this method in the public scorecard attribution methodology. Here's a flow chart, though, I think that really does a really nice job of summarizing how this is going to happen. There are only a certain subset of physicians that can have patients attributed to them. We're going to focus on primary care, the classic primary care specialties in the first step. We'll also introduce OBGYNs based on obviously for women at certain ages, an OBGYN can be providing primary care services. And then using a logical approach that's built off of what CMS does related to attribution, we have a set of specialties that, in the absence of attribution to a classic primary care provider, a patient could be attributed to. So what are we asking of you? Really, what we would like it to do is to begin to collaborate with your organization through a representative who we can contact to get some help around defining the boundaries of your organizations, confirming the affiliated providers who would be providing the services that we will be rating, to participate in some data validation activities. One step in that would be to provide an organizational profile of the claims that we have available for a rating, which would help us to determine if we really have the full universe of claims and whether there are any pockets of missing data that we need to be aware of. And then ultimately, we would like to work with you to review your organization's scores on the quality measures to make sure that we have the right population and we're accessing the right data in terms of coming up with these final scores. This is not a mandate. We might want to make it clear that we are not requiring anyone to participate in the process, but we really like it. We'd like this to be a collaborative process that at the end of the day, everyone thinks is fair and has provided lots of different opportunities for input from the rated organizations. And then finally, here's the timeline for what we're doing with advanced networks. First is we've asked every organization to designate a contact for collaboration in producing these scores. And then today, we are holding the first informational webinar. We hope to have 2 or 3 more of these leading up to our publication of the final commercial scorecard in the fall. And then in July, August, and September, we'll be working to confirm the composition of organizations, to work with you around what the data that we have in the APCD says about your organization in terms of numbers of patients, numbers of providers, and the characteristics of those patients and providers. Then in September, we'll be looking to present scores to each organization to review with us and to validate. And then finally, we're looking at mid to late fall for a publication of the commercially insured patient scores. So at this point, I'll stop and open it up to questions or comments.